Cold stress. Cold stress training is about, of course, the temperatures, weather we face in the winter season. This is about that. Uh, there are a lot of conditions, especially in the workplaces, which we don't have any control over, like some of the hazards which we cannot control. Temperature is one of them. It could be both either heat or you can say low temperatures like cold. All right. Of course, this is because of winter season. We are going to talk about the cold stress. So let's have a look first of all, the course objectives. We are going to talk about what are the dangers of working in a cold weather. All right. Secondly, we will talk about what we should watch for. All right. We will talk about what can happen if you don't take precautions. All right. What type of effects or injuries that can occur, and how can these conditions be treated, and what is the best prevention, you can say, methods for those injuries and of course for those situations. But first of all, working in a cold weather, our body gives us some warning signs which tells us that either our body temperature starts it's dropping or if it's increasing. The normal body temperature, and we are talking about the core temperature of the body, that is 37 degrees centigrade or 98.6 degree Fahrenheit. All right, that is 37 degrees centigrade or 98.6 degree Fahrenheit. And your body respond to cold in the form of, you can say, hypothermia and of course, frostbites. But exposure to extreme stimulates cold receptors of the skin, which causes the cold thermal sensations. Or like it could be one of the thing is shivering, which is because of the cold thermal sensations, and stimulations of the sympathetic nervous system as well, which is, you can say, a form of hypothermia. All right, and of course, after that, we talk, when we have extreme temperatures in that environment, all right, we have these things, all right, like sympathetic stimulation causes, or a vasoconstriction in the skin and in arms and in the legs. There are further things we are going to talk about. All right, wind chills, all right, in extreme weathers, when the temperature is too low, all right, not too low or even lower than the normal temperatures, all right, and the wind is blowing, what you need greater protection for your skin and your body to keep yourself warm, because wind increases the risk that your flesh will freeze, like your blood, all right, and the body regulation temperatures regulation center can become inoperable in some cases, like which is a form of hypothermia, or and also your skin tissues can be damaged, and which is called frostbites. All right, there are two most important, all right, effects that can happen from the cold weather. First of all, that is hypothermia, and second one is frostbites. So the body is unable to retain its core temperature, then your body will go into hypothermia. Like when your body temperature drops from 37 degrees centigrade, less than that, it will be going into the hypothermia. But excessive cold on the skin tissues, or it can freeze your skin tissues either temporarily or permanently, and even your blood vessels can be damaged. So these are the two main effects of the cold weather. We will talk through that. First of all, hypothermia, as I said, when your body temperature drops. And to understand hypothermia, or to make sure that you know what hypothermia is, you will consider the symptoms, all right, that will appear in this phase. First of all, shivering, a lot of shivering, then blue lips or fingers, and poor coordination, like impaired coordination, lack of focus, because your core body regulation temperature is changed, all right, and of course your brain has been stopped working, or it has become inoperable, just like heat stress or heat stroke. Same thing in hypothermia, all right, because blood is not circulating properly inside your body, which will not reach to your brain. Then after that, as the body temperature continuously drop, these symptoms, which are shivering and bluish skins, nails and lips, and of course impaired coordination, it will become worse, Like it will turn into confusions. It will convert into faulty thinking, or it slower heartbeat. It slows down your heartbeat, and shallow breathing as well. Shallow breathing, because of the slow heartbeat, we're not getting enough oxygen inside the body. And in the worst case scenarios, or at these hypothermia, they cause unconsciousness, heartbeat not to be heard, or like it's too slow that it cannot be heard. No shivering, all right, just like heat stroke, if you're sweating too much, and when you get the heat stroke, you will stop sweating as well. Same thing, you're shivering in the mild hypothermia. When it gets worse, there will be no shivering and no detectable breathing. All right, and ultimately, death. All right, the worst case scenarios are death. So you have to be extremely careful. You are working in certain environments. Yes, of course, we don't have the control over the environment, over the temperatures of the workplaces and all that. And sometimes you're deliberately working in the cold weathers, like for example, the people who are working in the freezers, in that environments where it's too cold, artificial cold, or sometimes it's natural cold. All right, so you cannot control them, but you can prevent yourself from getting into those conditions. So treatment for hypothermia, first of all, what you have to do, bring that person to the shelter. Gently take the person to the shelter, because sudden movements can cause problem, because his heartbeat is already slow, and sudden movements will disturb the heart rhythm. That's why gently take the person to the shelter. Second thing, keep the person awake. Do not let him sleep, because of course, if the breath is already low and slow, too much slow, then it can be dangerous for that person if he sleeps. After that, remove the wet clothing. All right, if it is wet clothing. If not, then of course, wrap the person into the warm blankets. All right, and gradually warm the neck and underarms, groin areas, but not to the extreme levels. All right, you apply the heat over there, and of course there is a sheet, all right, a thermal sheet. You wrap the person's body in that. All right, that is the treatment for hypothermia. Next thing, apply direct body heat. All right, like heaters or other type of equipment should be turned on around that person to provide the heat to that person. And if the person is conscious, give warm and sweet drinks like soup. All right, and of course, monitor the breathing. Keep monitoring the level of response, or administer artificial respiration if necessary. Get medical help as soon as possible. These are the treatment, but our first priority, as I said, should be preventing these situations, or a prevention of hypothermia. So first of all, when you talk about the prevention, first thing is to understand the dangers. If you're working in certain environments, you must know what are the hazards, natural hazards as well as other hazards. And as I said, temperature is one of them. All right, so understand the dangers. Take shivering people to the shelter if this thing happened to any other person. Avoid cold exposure. And if your heart ailment or a lung disorder or diabetes, like especially if you have conditions like that, if you're a heart patient, if you have diabetes, or you have like asthma problems or something, then avoid cold exposure. All right, and of course, how you can prevent that, of course, with the clothing, or in staying in the environment, keep it warm and something, and eat high calorie foods. It will cause more heat in your body. Drink soups and warm and sweet beverages. Take regular breaks in the shelter and remove the damp or wet clothing immediately. Not let them on all the time, or especially when you are in the workplace and the weather is cold. So this is a prevention. Like I mentioned before, clothings. All right, and of course, workers showing any of these signs, all right, what they should do, they should immediately seek the shelter. All right, like extreme shivering, fatigue, drowsiness, all right, irritations, of course, confusions. All right, these are the signs of hypothermia. And when you these are the first signs of hypothermia or the cold weather. In that case, of course, what you have to do, stop your work, take a break, all right, and go to the shelter immediately. All right, but of course, in a warm place. All right, because we don't want things to get worse. And then after that, other people should monitor their symptoms on their own and get medical help, or if the worker's condition is worse, getting worse, or fails to improve. Like, of course, the most important thing in these situations is to call an EMS, emergency management services, or medics, paramedics, uh, in your workplaces, either in your workplaces, or call them from outside source, calling an ambulance or something. These things become very important when you are in certain situations or environments like that. All right, then the next thing is frostbites. Whenever your skin is exposed to an extreme cold, or they are in contact with extreme cold items like metals, it could be even gas as well. Like, for example, carbon dioxide gas, an extreme cold gas. When you're exposed to that gas, you will have the frostbites on your hand, especially if it's exposed to your hand. Wherever it will be exposed, you'll have the frostbites. Because in that case, the tissues inside your skin will freeze. And either they can be damaged temporarily or permanently. All right, permanent damages, of course, they can be extremely dangerous. So that's why you avoid these extreme cold surfaces or environments. All right, and then heat is lost, or in the later case, transferred to that atom. Then early symptoms includes a prickling sensation, numbness, all right, a waxy appearance, like if you touch anything, you feel like it's touching it, there's a waxy appearance, and not always pain. Sometimes it does not pain, but when it gets worse, of course, it will be turned into the pain as well. Clear about the frostbites? So these are the frostbites. Now, frostbites is most likely to affect your face, ears, fingers, and toes, because these are the things that mostly, of course, you don't cover, especially your face. All right, so that thing can be exposed, that cold, you can say temperature, weather, wind, or something can be exposed to your skin. All right, on your face, on your ears, or your fingers or toes. And it left untreated, because people don't think it is a problem, but they can be getting worse. They can get worse by the time. All right, so if they are left untreated, frostbites blackens and blisters the skin. All right, which eventually turns into a gangrene, like you can see here in this picture. That type of course, your skin will be damaged because the tissues inside the skin is not proper. All right. Furthermore, when you talk about the frostbites, these can be the situations, or especially to your toes and to your skin, like not in the start, but of course, if they get worse, of course, it can be turned into that. Like, it is not pretty. Of course, no one says it's pretty. And you can lose your toes as well. Like, once the frostbite happens and it's permanently damaging your tissues, permanently damage your tissues, then in that case, you have to remove that skin, or if it is damaged. Otherwise, it can be increased. So let's talk about the treatment. First of all, what you have to do, rewarming of the skin. All right, when there is the situation like that, it causes a frostbite, of course, rewarm your skin. And oral pain medicine, you can take the medicines for that. Protecting the injury, make sure it is not exposed to the more cold temperatures. All right, and then after that, removal of the damaged tissues. Or like, this is when the conditions get worse. This is when you remove the damaged tissues. Then whirlpool therapy or physical therapy of those tissues to make sure that when they regenerate. And infection fighting drugs, all right, clot busting drugs, and wound care. These are some of the things that you can do to treat the frostbites. All right, but of course, some of the things you can do it on your behalf, all right, as an individual, as a worker, in the company, but of course you are not a specialist, a doctor or a paramedical staff. So in that case, what you will do, just rewarm the skin and make sure that you will not expose, all right, to those cold surfaces and temperatures again, to avoid it to get worse, to avoid it to get worse. All right, but first, what you have to do is to prevent it before it happens. Prevention is your strategy. So people at the added risk, those who have had frostbites previously, or they will be the people who will be at more risk. All right, second, the people, those will with the heart ailments, heart conditions, all right, or the people who have the pacemakers or something like that. Those people who have asthma, or they have bronchitis and diabetes, the medical situations, long-term medical conditions. Then those with the vibration and white finger disease, like you can say numbness on their fingers, if they feel vibration. If they have the disease like that, of course, they will be at added risk. That means they are at more risk than normal people. And those at certain medications. That is exactly why every company, they keep their employees' health records with them, to ensure that if they have situations like that, they will not be exposed to these things, or they can be taken care of. So if you have a situation like that, check with the healthcare practitioner. Okay, guys. Next thing, of course, the prevention. Prevention, the same way we did for same way we did for hypothermia. So preventive measures: do not leave your skin exposed, especially like if it's too windy or wind is chilly. Of course, it can cause frostbites on your face, not suddenly or not straight away, but of course it will take time. And of course, your skin will become drier or something. All right, and of course, eventually it will turn into a frostbite because it can damage your tissues. It can freeze your tissues, and it can be damaged either temporarily or permanently. So that's why do not leave your skin exposed, especially your fingers and toes. All right, and then of course after that your face and your ears. Otherwise, you have the protective clothing, especially in the winter season. You have your coveralls and other protective clothes on you. Furthermore, whenever it's possible, you have to schedule outdoor work for warmer times of the day, like in the middle of the day, not in the night times or in the early morning. Should be avoided, especially in the conditions like that. Reduce physical exertion in the cold weather. All right, then after that, job share to reduce the length of the time or each worker is exposed, like rotation of the job. So the people are not exposed to these hazards more for the more time period, and give them frequent breaks as well. All right, have warm liquids available, but not caffeine or alcohol. All right, not caffeine or alcohol, but other warm liquids should be available to keep your employees warm and of course healthy conditions. And after that, have a shelter nearby that. So in case a person is exposed to these conditions, all right, they can be taken care of immediately. Next, monitor your co-workers' appearance and behavior. Like especially the first sign, of course, the person who feels that he's having a hypothermia or is having the frostbite is himself. But not only just that, he will be monitoring himself, but as a co-worker, you should also monitor his behavior and appearance. First of all, for example, if he's wearing a half sleeves and shorts and working in certain environment where it's too cold, of course, you have to tell them that to avoid these situations, you must get your proper apparels. All right, wear those protective clothings. And also their behavior, when they are being exposed to that temperatures, of course their behavior might change. All right, like irrational behaviors is one of the most common thing in the hypothermia. And of course you have to make sure that you will notice that and report it, and of course ask that person, all right, if he needs help. Next thing, keep the blankets, matches, rain gear, extra clothes, and emergency flood supplies nearby. Like, of course, these are the extreme conditions, like if you have situations like that, but still, as a backup, you have to have these things. Furthermore, share the information about the effects of the cold exposure with the co-workers. Like training, you should have proper training so that you can understand what can be the signs and symptoms and how to prevent these things, how to prevent these situations which can lead you to hypothermia or which can lead you to these frostbites. All right, so let's have a quick review of all the things that we have discussed. First of all, as I said, in the workplaces, you have the situations or in which you don't have any control over. Temperature is one of them. It can be too cold, it can be too chilly. So if it's extreme weathers, you make sure that you will protect yourself from these conditions. First thing should be prevention. You prevent, all right, by job rotation. Make sure that you will not expose to those temperatures. Protective gears should be with you. Do not leave your skin exposed. So these are the prevention measures. But once it happens, then after that, proper treatment should be done. Like the first thing before any treatment is to call an EMS. And when you call an EMS, all right, after that, you will provide the treatment. Like bring that person complete to the shelter, all right, in the warm areas. Try to re-warm their skin, all right. Wrap the person into the what you call that one, heat blankets, or which keep the body warm. Secondly, try to keep warm those areas, like especially their underarm, their forehead, the groin area, to make sure that their body temperature comes to normal. Or and put those equipments which can warm the environment, which can heat up the environment. Clear, guys? If you have any questions related to the cold stress, just let me know about this.
Any question, please?
Any question from anyone? I can understand that you will not face too extreme temperatures here in Saudi Arabia. All right, but of course, still it can be dangerous, to certain extent. Yes, anyone?
I don't think. I think there is no question. Thank you, Mr. Abaid. Thank you all for attending this training session. Yeah, if there is any conclusion, Mr. Abaid, go ahead.
All right. Thank you, everyone, for your time. Hope you have enjoyed the session. All right. So